they won't have that discomfort because they're so heavily sedated. Now you got to deal with the monster of treating that addiction. Hey everybody, it's Dr. B Addiction Recovery, and the topic I'm going to dissect today is benzo dope. I'm going to do a mini deep dive. We recently did one on trank dope. Let's get started. Let me go from the top, okay? I recently saw a Vice documentary on this stuff, and I thought it was over-sensationalized, over-dramatized, a little bit of fear-mongering, great production, minimal, real, meaty information. I want to dispel the myths. Benzo dope. Benzodiazepines and opiates, right? That's what we're talking about. A mixture of benzodiazepines and opiates. For the most part, people are injecting this stuff. What is the issue here? The issue is that because benzodiazepines can be a heavy sedative, depending on the dose, you are synergistically compounding the potential for an overdose. The sedation, the opiate, right, decreases your respiratory drive, you stop breathing, eventually your heart stops. The sedative effect of the benzodiazepine is so profound, the organism does not perceive the fact that they're in need of air, does not perceive the fact that they need to respond physiologically. It might be a blocked airway with some food down there. Just to give you an example, they won't have that discomfort because they're so heavily sedated. Now, opiates have a sedative effect to some extent themselves, but now you are having the respiratory drive cessation in addition to the sedative effect of the benzodiazepines. Overdoses go up. In fact, nowadays, and I did some video some time back, we shouldn't even look at substance abuse as opiates anymore, as methamphetamines, as alcohol, as cocaine, as benzodiazepines. It's polysubstance abuse. Both the drug themselves have changed, but the demographic and the social characteristics of the user is not what it was 50 years ago. Opiate users hang out in that crowd, and speed users hang out in that crowd. Very different persona. That's not the case anymore. And mixing two drugs is nothing new as well. We had speedball, right, which eventually was called, given the slight changes in the stimulant that was used, goofball, right, in the last 20 years. We have trank dope, right, the xylazine tranquilizer, and opiates. We also have a mixture of cannabinoids and opiates, okay? So benzo dope, whether someone's taking it by itself and then adding the opiates or the mixture, is really nothing new. It's just increasing the possibility of overdose sedation. But there's a little bit more to this than that. One, the new synthetic benzodiazepines that are being illicitly manufactured are frightening, right? Because the measured dose is unknown, and some of them could be very heavy. That increases your likelihood and your chance of overdose. Two, keep in mind, when you do have an overdose, proceed as if you're just moving forward with an opiate overdose. The Narcan, if you're using it and if you have it, is not going to affect the benzodiazepines, but you still need to get the opiates out of the system, and then you move forward as you would given the situation you have. This is not a training video, so I won't get into that, but basically it's going to be what we call clinical supportive care. Three, now you're dealing with two severe addictions. We discussed trank dope, and I don't think there's enough evidence to think that the component of that xylazine, in addition to the opiates, is something that potentially needs to be treated in the long run for itself. Xylazine, severe xylazine addiction. The data is still to come out over time, but nevertheless, from what we've seen, there's going to be severe anxiety, but that could be from the acute withdrawal, and it'll be over in 3 or 4 or 5 days. And then now you're unmasking the long-term anxiety the person's had anyway, but you got to treat the opiate addiction. In this case, you got to treat the opiate addictions in the situation of addressing the addiction and the long-term withdrawals. And for me, that's medication-assisted treatment. Suboxone, buprenorphine, you got to treat the cravings, you got to treat the withdrawals, and the long-term maintenance. Also, there's methadone. With benzodiazepines, if you're using this stuff, and if you get out of the regular use of life without overdosing, and if you've used enough for long enough, now you got to deal with the monster of treating that addiction, which for me, usually, depending on the case, is going to be a very meticulous, very, very compassionate long-term taper. So you've added something to the plate of the provider and the crap you gotta deal with. One other issue as well that we need to consider here, the withdrawals, the acute situation, which makes me much more concerned, is very different than withdrawals from opiates, right? This class of medication is called sedative hypnotics. And if you've been using enough, and if you've been using it for long enough, right, the withdrawals are potentially dangerous. Opiates, I don't care how difficult, if you threw someone in a room and gave them nothing for supportive of their withdrawals, acute withdrawals, painful it is, we know they're not going to die from that drug withdrawal. The benzos, you are going to have severe vital sign changes, blood pressure, heart rate, and then there's the concern for seizures and potentially death. That's the other issue with this drug. So when someone's treating it, they have to address first the opiate, then take a look at the withdrawal acutely, see how severe it is, potentially manage it shortly with whatever it is they're going to manage it with, some sort of other cross sedative hypnotic, and then consider the need for long-term care and tapering if that patient has been on the benzodiazepines or benzodope long enough where they've developed a physiological tolerance, need, and really addiction to the benzodiazepines. Want to give you my 2 cents on this. I think some of the stuff in the media over dramatizes, over sensationalizes, creates fear, stigmatizes the user, and we don't need that. We need formal education, thinking, approach, compassion. See you guys next time. Like, subscribe, peace.